Prevention, from Narcan worn on police officers' belts to doctors overprescribing, a new push to take control of drugs politically to try and stop this health crisis. We've heard about it. Well, joining me for today's Take Action Thursday, Deputy Secretary of Health, Dr. Howard Taft, along with Michael Baer, Overdose Prevention Director for the Maryland Department of Health and Mental Hygiene. Gentlemen, thank you so much for coming in.
You're welcome.
Dr. Taft, let's talk about this as how big of a problem are we facing here in America?
We're in the midst of a public health emergency and crisis right now. There are 40 or more people who die every day in this country from opioid overdoses, so it's a major problem.
When was it, though, when it crossed the line and went actually to a health crisis? When was that labeled, I guess, that way?
You know, of course, that doesn't happen overnight. I think this has been a decade or more of progressive increases in people dying from overdoses from opioids, and it's really been something that's quadrupled in the last 10 years. So it's been progressive, but I think we've recognized now that it's clearly risen to the level of requiring major responses.
And the major responses happening right now. And in fact, what are some of those responses? I know that you have something in your hand right here that we're talking about.
Sure. So what I have here is called naloxone. The brand name is also Narcan as well, and this is actually a brand name product called Evzio. And naloxone is a prescription drug. It's been used for decades to safely and effectively reverse an opioid overdose, mainly used by medical practitioners. But really for the past 20 years in the U.S., lay people, just average everyday people, have been trained to use this if they themselves are at risk for overdose or they have friends and family that are at risk. And it's really been demonstrated to be effective, has very low risk of side effects, other types of adverse effects. And it hasn't been demonstrated at all to increase drug use or riskiness of drug use.
That's what I was going to ask, because you get this argument. People are saying, you know what, okay, here we're taking away the severity of overdosing on illegal drugs, and we're kind of giving people a second chance. It's a twisted kind of approach to it, but there may be a little bit of validity there, saying, you know, that, you know, if you've got a safeguard, then all right, we're going to have more people using.
So I think we have to recognize drug addiction, opioid addiction, as a chronic health condition. And you know, people cannot recover from a drug addiction when they're dead. So we really need to do everything we can to keep people alive. And again, there's been research about this for decades now, and the research has not shown that it really increases those risks, but it is increasingly showing that it decreases the risk of overdose death.
All right, Deputy Secretary of Health, Dr. Taft, thank you so much for coming in. We appreciate that. And Mr. Baer, you're going to stay with us because the next segment, we're actually going to demonstrate how quickly and easily this can happen. We're going to walk through the process on the 2.5 minutes it takes to actually bring somebody back.
That's right.
Or save their lives, I guess I should say. All right, well, it is our Take Action Thursday. And of course, if you have any questions about what we're talking about, naloxone and some of the other methods that are here to fight overdose, give us a call right there, 410-481-4545.
Or at aqua.org.
All right, we are back this morning, and joining me is Michael Baer, and he is here to show us a little bit of a demonstration. And along with him from the Maryland Department of Health and Mental Hygiene is Aaron Haas, who now is going to perform basically saving a life, and how this new product, naloxone, is actually going to be used to do it, and the different techniques that are that can save somebody that is an overdose. So we're, of course, are going to be going through the process right now. So thank you very much for coming back with us here.
No problem.
So if you don't mind getting started on what happens, this is apparently the dummy is somebody that we know has overdosed. Is that correct?
Exactly.
Okay, and so how would we know, Michael, if you don't mind telling me, how would we know somebody has overdosed on a drug like heroin?
Sure. So in the trainings, one of the first things you learn about is how to recognize an opioid overdose. And clearly slow or shallow breathing is a major sign, but also lips or fingertips turning blue. And if they don't respond to stimuli, like rubbing the knuckles on the chest, that's a pretty good sign that they are in an overdose state, and that's when you would want to initiate the 5 steps to respond to the overdose, which Aaron will demonstrate.
And Aaron, if you can go through those 5 steps, we'd appreciate it. Let's just sit back and watch you do it.
Absolutely. So the first step, like Michael mentioned, is checking that the person is experiencing an overdose. And just rubbing your knuckles firmly on their breastbone is enough to get the person to start breathing again if they are just sleeping. Next, if there is no response, they're not breathing, they're still unconscious, you will call 911. and assemble your naloxone.
Okay. And then to do that, because, and keep going, please don't let me stop you there. But it used to be almost like an EpiPen, is what you thought is the way that it would go in. But you were holding a different device,
That's
Mr.
right.
Baer, earlier that looked more like a nasal injection.
That's right. There's a couple different formulations. Aaron has the one that's most commonly used,
Okay.
which is an intranasal formulation. It's basically a nasal spray. The one I had earlier was an auto injector like an EpiPen. It's a newer version. And then there's the newest product that's out is another nasal spray that doesn't require assembly like this.
And so basically, we're just going to put this into the nasal cavity and
Yes.
and then push
do.
through, as opposed to actually an EpiPen where you're jamming it into a person's leg or a
Exactly.
part of their body. Okay. And both nostrils too are important in that.
You do half on each side.
Okay, all right, well, there you go. All right, we're learning more and more, and of course, you guys can teach us even more at the Be More Healthy Expo that's coming up this
Exactly.
Saturday. You'll both be out there?
This Saturday, 12 to 3, we'll be doing live trainings.
Okay, so if you have any questions right there, thank you, Ms. Haas, Mr. Baer. We appreciate your time coming in.